setting up our flag so that people can see what we're doing. 20 would be a busy day. Usually we get sort of minimum 10. On a sunny day, it can be up to like 35. How many nurses does it take to construct a flag? We're doing our community liver screening from the van, so anybody who passes can pop in and get screened for liver disease with our fibre scanner. We're teaming up with the community health check clinics, which are just happening up the road there. So generally someone will come, have their sort of blood pressure checked, height and weight, things like that, and then they'll pop and see us and they can have a liver screening done. Anyone that we find who may have possible cirrhosis, we're going to get them to come and see us again in clinic and get them to come for 6 monthly ultrasounds with the hope that if their liver developed a cancer, it would be caught at an early stage. Did you want to come up?
Yes, please.
Come in for your liver screening, yeah?
Yes.
Fab.
I thought, well, it might be, while it's here, may as well take advantage of it. I'm sure I'm probably all right, but you never know until you know, do you? It's one of those.
My name's Sally.
You all right, Sally?
How are you?
Yeah.
Take a seat.
All the better when I get you all clear on the
Oh,
liver.
okay, great. Have you ever had a liver scan before?
I don't believe so, no.
Okay, so Kevin, how this works is called a fibro scan. So what I'm going to get you to do, you're going to lie out.
Right.
I'm going to have a feel in between your ribs. And we use this probe with a little bit of cold jelly on the end.
Right.
It doesn't hurt at all, but you're going to feel a little buzz there, and it's sending a little vibration through and looking at the stiffness of your liver. So a healthy liver's got a nice wobble to it, whereas a liver that's got maybe some scarring or some stiffening through inflammation doesn't move as much.
Right, okay.
Really quick, should be over in about 2 minutes, and you get instant results, so I'll talk them through with you.
Right.
Happy?
Yeah.
Great, so can I get you just to scooch down a little bit more? That's lovely. And I'm really sorry, but the gel does feel quite cold, so think of something nice and warm.
Does that work?
Probably not. Imagine you're on a nice tropical beach. Right, so just feeling in between your ribs. We always do 10 just for a little bit of reliability.
That makes sense.
Yeah. The measurement of your liver stiffness is 7.8.
Right.
So what we tend to say, lower than 7 is absolutely ideal.
Right.
But we don't bring people back into clinic to see them and have appointments with us until it's above 11.5.
Right.
So I'd say yours is just the highest end of normal.
Right.
Have you eaten recently?
Last night at 7 o'clock.
Okay, so it may be that your liver's just ever so slightly stiffer than normal, just because, like you said, you did used to have quite a heavy pattern with drinking.
Right.
With alcohol, we know that it inflames the liver, and inflammation in the long run can lead to scarring. You absolutely do not have any scarring whatsoever. Careful on the stairs. Cheers,
yeah.
bye.
Have a good one, guys.
All right, come on through. My name's Sally and this is Becky. Have you ever been told you have any problems with your liver, like fat on your liver?
And I don't know, but I know many of my family and friends and kind that have problem liver.
Other family members?
That's what I'm check.
Okay, great.
Right. One more. 4.3.
Normally, what?
So that's normal. So we're measuring the stiffness of the liver. So we want a nice wobbly liver.
Okay.
4.3 is good.
Right, come on through. My name's Sally.
My name is Rohit.
Take a seat. So that was a really normal score. So your score is 5.2 kilopascals. The only thing to watch out for is just your BMI ever so slightly on the higher side. As you get older, what that can mean is that you can develop fatty deposits around the liver, which over time can lead to inflammation and scarring.
I'm working on
Just
that.
something to bear in mind. I mean,
working on that.
yeah.
I was happy with the results and with the services also. They are good.
It's been really busy. Yeah, we've had quite a diverse range of people coming in. Some people that have just walked past and coming off the street. Some people that have been directed from their health checks in the charity next door. Yeah, it's been fab. We haven't picked up anyone with a problem, but what we have done is raised a lot of awareness about liver disease. So we have had a lot of people turn up who've sort of said, oh, I don't drink alcohol, I'm not at risk. And we've been able just to give them advice on diet and lifestyle, and that it's not just alcohol. A lot of people with a higher BMI and type 2 diabetes. So we've caught a lot of people who could well have had high results. So if you were found to have a high result, we'd get you to go for an ultrasound scan and come and see us in clinic. Scanned 14 people, which was amazing because the organiser predicted would maybe get 3 or 4.
Are you finding that when you've got quite a busy session like that, do you feel you have the time to counsel people on their risks and the lifestyle changes?
You know if you need to stay and have a chat with someone afterwards and spend a bit of time, it's totally worth it, yeah.
We've got the liver health check follow-up clinic, so this is the place where we see people whose results on the screening visits have been a bit abnormal. And we put together that result with an ultrasound and a blood test usually, look at the person, talk to them, find out their history and try and work out where they might be on the liver disease spectrum.
Hiya, it's Becky calling from the BRI.
We hope that by detecting liver cirrhosis earlier, so scarring of the liver, we're able to offer people the treatment they need, put them into surveillance for potential liver cancers in the future, and also just give them the chance to make any lifestyle changes that might help them. He's had an OGD as well, so I can chat to him about that. And he had a small varix. Kenzie, I've got Sally with me, who is the one person you haven't met in the team.
Oh, not Sally. Hello, Sally.
Hi, Kenzie.
Hello. Pleasure. Howdy.
Yeah.
Since I last saw you, you've had your endoscopy.
Yes, that was riveting.
Did you watch?
The fentanyl had a good play in, really.
You understand what we found?
What I remember, he said there was maybe one that maybe, like, minimal.
Yeah. Exactly.
But nothing to worry about at the moment.
Exactly.
As long as I keep to what I'm doing.
But that's exactly it. There's a small varix there, which is too small for us to need to treat. But like I said, if things were to progress further, that would potentially grow in size. So sort of when we see you in 6 months or however long it is, we'll just keep thinking about how the picture is evolving. And if you're getting better and you're making those changes, it may be that we don't need to look again, but it may be that we say, oh, let's do another endoscopy in a year just to make sure.
I'm still now significantly lowering my drinking.
Well done. In April, roughly, would be when you're next due an ultrasound. So we talked about when you have the scarring of the liver, sort of everyone has a population baseline risk of getting a primary liver cancer. When you get scarring of the liver, your risk sort of does that. So it's, it's not up there, but it's enough that we want to look at it every 6 months. So we'll aim to do an ultrasound and a blood test every 6 months.
Yeah, I'd appreciate that.
Yeah, it's been quite intense, and actually now we can sort of say, okay, we're in the background, we'll see you 6 monthly. We aren't going to harass you all the time, but equally, if something were to happen or you'd feel unwell in a month or so, you've kind of got direct access to us if you need it, so you can pick up the phone and we'd see you quicker.
Sounds like you've done a really fab job with how much you've been cutting down the alcohol. Obviously, the ultimate goal is for no alcohol whatsoever, but it sounds like you kind of got that in mindset.
Yeah.
Yeah?
Yeah, most definitely.
Obviously, we meet a lot of people, and you to be where you are now compared to when we first met you, and then looking back to where you were, like, it's really impressive. Not everyone manages that.
All right, well, pleasure.
Lovely to meet you.
Take care, guys.
We'll see you soon.
All right. Cheers.
I was very pleased that I had it done because it wouldn't have been picked up otherwise. Yeah, it was just by chance that they picked up that I had this trouble with my liver. We meet again. We meet again. We met at the event, didn't we? Yeah. Hello.
How are you doing today?
Yeah, not too bad, thank you.
My understanding is that you're 61 years old.
That's right.
Is that right? And you came to one of our sort of health promotion events. And you had a FibroScan, which was to look for stiffening of the liver or scarring, which was a bit abnormal, and that's really what today is about. Okay, and then you've gone on to have the ultrasound of the liver, and we've got some blood tests from before as well. Is it all right if I sort of explain to you what I think's going on in your liver?
Yes, that's absolutely fine. Yeah.
So there definitely is essentially fat deposited in your liver, so we call it fatty liver disease. Over time, that fat can build up and it can cause inflammation, and that inflammation can progress to scarring over time. And when we try and work out where people are on that journey sort of thing, and I think that you are quite far down that journey towards scarring. I think your liver is scarred, but it's still a really great time to sort of take control of the situation. And also do lots of positive things. So one important thing is going to be thinking about your lifestyle and diet. I think you and Sally spoke about it a bit at the time, Is that something you've had a chance to think about?
Well, I was at the chemist and they gave me a leaflet regards healthy eating.
Yeah.
And I've just joined, a healthy eating plan, and I seem to be on track with that.
Oh, no.
And then I decided that I was going to start exercising, and I don't like to do anything I don't like the gym or anything.
No.
I'm not really an exercise person.
Yeah.
So I've started swimming, so
Yeah.
I try to sort of do as many lengths as I can in half an hour. So I'm usually at 6:30 in the morning, so I'm
That's
started.
amazing. That's really
Yeah, I've
impressive.
started. Yeah, I'm on the right track.
I can't speak for you, but that's more than I do. So it's really amazing.
Yeah.
Hopefully over time you will just start to
Yeah.
feel that fitness. And what we know about liver disease is that the liver is really quite good at regenerating itself. I don't think yours is ever going to be completely healthy, but you can keep it in check, and you can keep it at this point where you wouldn't know you have a problem. We know that having scarring of the liver puts your cancer risk a little bit higher for liver cancer. Not enough to, I don't want you to be super worried
Panic,
about
yeah.
it, don't panic.
No,
And your
no.
scan shows no cancer at the moment, but what it means is that we suggest regular screening. So for you, every 6 months.
Okay, that's lovely. Thank you very
That's
much for your help. Yeah, thank you for your time
Thank you
today.
for coming in.
No, thank you. More exercise, more healthy eating.
Are you able just to roll your sleeve up? Is that okay?
I had the FibroScan, which is completely painless and, easy. But one of my readings was a little higher than it should have been. So yeah, that was a bit concerning, obviously. But I got a referral to the hepatology department at the hospital. That came through really quickly, as far as I remember. And then I had a whole series of more tests following that.
She was one of the first patients that ever came to the clinic, so I remember her really well. It's lovely. How have you been since the last...
Very
we
good.
spoke on the phone, didn't we? Still really good.
Yeah, all very well.
And I think, without sort of beating around the bush, you've just had that FibroScan.
Yes.
I don't know how much they said to you about
Well,
it.
nothing at the time.
It's pristine, Maggie.
Oh!
It's completely normal. So I think the changes
This
you've
is
made,
wonderful.
I think the inflammation that was there,
Yeah.
you've done it. It's completely healthy.
Oh, that's brilliant.
Isn't that amazing? Yeah.
What's the number?
So
I remember
it's-
it should
yeah.
be between 0 and 7.
It's 3.8.
Oh, brilliant.
It's much healthier than both of our FibroScans.
Yeah.
Oh, wow.
So in the room you are.
Oh, you'll get there, will you? It'll get better and better.
Everything you've done to get to this point,
Yeah.
it doesn't. It just means that if you can keep that up,
Yes.
then you should remain completely healthy from a liver perspective.
I've been signed off, discharged. They even told me my liver was healthier than some of the medics. I have been trying really hard over the last few months to just lead a really, really healthy lifestyle, and it's really great to know that that's all paid off. And things have actually really improved from where they were. So it just goes to show that you can make really good changes. And I'm delighted. I'm really, really pleased.
Just by chance, she happened to be in the same building on the same day I was there doing a screening, turned up for a FibroScan, maybe not quite knowing what she was signing up to, ended up finding out some less than ideal news, but through that has made some really important changes and really managed to kind of turn her life around and put her risk much lower down. And yeah, it's amazing. It's just great that to see right in front of us that the work we're doing can have actually a big impact on people's lives.
It's just huge. It just helps us to think that what we're doing is helping people, and that people can make changes that feel big if they take small steps. So I think, feel very inspired by her.